Hi guys, I hope all of you are doing very well and are safe during this pandemic time. Well, the second wave is almost getting over and everything is opening, but I hope that you remain safe and use all the requirement protection that is required, at least a double face mask. Now, moving on to the today's topic, that is, what are the 6 things that an intern must do during internship? Well, interns are fresh doctors who have just passed out from the final years, and be it your BDS or MBBS, and have just attained the title of a doctor. Well, when utilize this year, that is the internship year, very well, or according to your goals, if you utilize it the way it is supposed to be utilized, then trust me, you can make an exceptionally well doctor, because this is the year where you can actually go ahead and learn, and nobody will probably hold you responsible for the small mistakes that you are doing, and hence this is the time when you can actually practice the most. So depending upon what your goal is, either to pursue PG further on, or to be a practicing doctor or a dentist after your internship, it is very important that you utilize your internship period very efficiently and very productively, so that it can bring results to you, either that you get your post-graduation seat or you become an exceptionally well dentist by developing your skills. Let us see that 6 things or 6 tips that I can give you that you should be doing while your internship. Hi guys, and welcome back to my channel. I am Dr. Noor Saira, an endodontist and a part-time YouTuber. Well, I make videos on exam strategies, productivity habits, productivity lifestyle, and guidance for NEET, MDS, or any competitive examination. Well, if you haven't subscribed to my channel yet, go ahead, subscribe and hit the notification bell icon so that you're notified every time I upload a value-based video. The first thing is to do not lose focus when you are in internship. Now, it's very easy to lose focus when you are in internship because you have struggled in the first 4 or 5 years of your BDS or MBBS, and now is the time finally when you feel a little free. But this should be the year actually where you should not be losing focus. Well, a lot of students tend to utilize this time by bunking the postings and having fun, but it's very important to strike a balance between having fun and doing things that you actually need to do. It's very important to learn the skills that you are supposed to learn, respect the postings that you are posted into, and learn everything that you can from those postings, because this is exactly what will fetch you your skills, the development of your skills. It's exceptionally important, and because the moment you are out of the internship, there is nobody who's going to teach you. It's all on your own, and you will be held responsible for the mistakes you do in your clinical practice, and you will be solely responsible to or answerable back for that. So this is the time you can actually learn how much ever you can, and hence make sure you enhance your practical skills during this time. Be it anything, be a dental student or be it a medical student. So if you're a dental student, make sure you enhance your practical skills, do more and more cases, learn more and more, try to attend more and more postings as much as you can. Giving an example of myself, well, I fell in love with prosthodontics when I was doing my internship, and I did have a very good relationship with my professors and teachers, so that was an added advantage to me, probably because I was a topper throughout, and hence I could attend or learn extra things which were probably just taught in the post graduation. So I did insist them on teaching me things, and they were very flexible to teach me. So went ahead and learned about occlusion, and I learned about multiple other things which are normally not taught in internship or during the final year. So I was basically trying to improve my skills. Another thing that I tried to do during my internship was that if patients were unable to afford treatments, I would pay for the treatments in the most minimal way possible and try to learn things and do it on them. I would try to get our watchmen, or I would try to get a needy who was not able to pay for the treatments but require the treatments, so you can get the treatments done and learn on them. So this is the time where you actually can actually raise the bar by doing more and more cases and improving your skills. Second important thing is that do not lose confidence when you do mistakes. Now, some people are overly sensitive, and some people, when they commit a mistake, they stop learning there and they don't move forward. But what you need to understand is that's how you're going to learn. And this is the only year, that is internship is the only year where you can actually commit mistakes, the minor mistakes, of course not the life threatening or really big major mistakes, the minor mistakes, and you can actually learn from them. Ask the teachers, ask your seniors, interact with them, talk with them. Don't feel disheartened when you do a mistake. When you do a mistake, feel more motivated that you have understood where you are doing a mistake and now I will rectify this mistake. Have no shame. In internship, have no shame. Try to learn as much as you can. Trust me, after internship, if you're not doing your post-graduation, you are on your own and nobody's going to teach you anything, especially related to clinical skills. So it's very, very important that you learn your clinical skills, you master how much ever you can master, at least the basic things that are required to run a practice. So as you have just transitioned from textbook knowledge to your clinical skills, purely clinical skills, mistakes are bound to happen. So again, don't get disheartened when you are doing these mistakes. So try to learn from them. Get motivated when you are doing these mistakes. Be a little shameful. It is okay. This is the time to learn. So do as many as cases you are able to do. Don't feel burdened by these cases. Don't feel like, oh, I am the one who's getting to work. But I think you should think it the otherwise. Oh, I am the one who's getting to, enhance my clinical skills. So take cases as an advantage. Do how many ever cases you can do, enhance your skills and try to learn new things which are actually not taught in the internship. For example, in some colleges, root canals are only for postgraduate students. So try to, have a good relationship with your professors. Try to tell them that you are interested to do it and you are ready to do your preclinical work, and you can actually try to do some cases or probably anteriors or to premolars, and this is where you can actually learn. Try to do good composite restorations, assist your professors when they are working, and try to learn some prosthodontic skills when you are in your postings. Not only basic RPD, not only basic CD, but also learn about occlusion, the functional occlusion, what goes wrong, what goes right, a little about temporomandibular joint. Develop your relationship with your professors. Try to interact with them at a professional level. Learn these knowledge. It's very, very important. That will open areas for you when you go ahead and start your clinical practice. It will make you understand which branch you would probably want to choose. Okay, so don't get scared by your mistakes. Don't get disheartened by your mistakes. Now, rule number 3 or tip number 3 is that do not take criticism seriously. Okay, people are bound to criticize you no matter whether you do good or do bad. So do what you have to do irrespective of what anybody is saying. What I'm trying to say here is there's a lot of going to be your colleagues or your batchmates who are going to criticize by saying that, oh, you're working so much, what is big that you're going to do in life? Don't listen to all that. Don't listen to anything disheartening that they're going to say. Only because they are not able to do it doesn't mean that you should not be doing it. You want to learn, you go ahead and learn. You want to put efforts, you put efforts. If you're doing mistakes, that's okay. At least you are putting efforts. That's what matters. So go ahead, learn. Don't let anybody's words hamper you, be it any professor, be it any teacher, be it your colleagues, be it your seniors or be it your juniors. If you want to put extra efforts, go put extra efforts. Don't let anybody dishearten you at all. Rule number 4, go back and read. It's important that when you are doing your postings, when you know or understand that, okay, this case I am not able to understand, or this is something beyond my knowledge, or this is only PG level, do not underestimate yourself. If you think that you do not know something, and if probably your PG is doing some case and you are around them and you understand, okay, I don't know this topic, go back and read it. Go back home, read the chapter, understand the clinical logic, come back, discuss with your seniors or discuss with your professors or discuss with your colleagues. Find a partner who is equally interested in doing so. Develop your skills. This is the time that you can actually do it. Please do not waste this time in hanging out with your friends, going out partying. It is equally important, I understand, but it's important that you strike a balance when you do this. So, go back and read whatever things that you do not know. and come back and apply it the next day. So this is very, very important. Do it, and you keep this up and keep it consistently. You will be way different, or you will be developing your skills way much more when compared to others, and you will see the results when you open your clinical practice, or even if you go ahead and join your post graduation, because comprehensive information about all the postings or about all the different branches is very, very important when you are doing internship, and you're doing what you're doing after internship. That's either be your post graduation or be it your clinical practice. And the tip number 5, or the rule number 5, is that you'll need to learn the local language of the city that you are doing your internship in. This is very, very important to know the local language, because we know people come from different cities. For example, somebody from the north could be studying in a college which is placed down south, or somebody from the south is maybe practicing or doing internship towards the north. So it's very, very important that you learn the local language, be it Tamil, be it Kannada, or be it Hindi for that matter, because it not only helps you develop a relationship with the patients, but it helps you understand the patient better, it helps you treat the patient better. So it's not only helps the patient but also helps you, because it will be a game changer when you develop your clinical practice, or even if you go ahead and try to pursue your PG in the same city. So because we know it is just not about doing clinical practice, it's just not about having good knowledge about your skills, it's not just about having good knowledge about the subject, but it's also about how you develop a relationship with the patients. And that is one of the biggest game changers when you have a clinical practice. So develop that in your internship itself. I did that mistake. I couldn't learn the local language. Even though I am a South Indian, I still cannot speak Kannada properly, because I was brought up way abroad, and I lived there for the longest of the times. I was brought up in Saudi Arabia, so I lived there for 15 years, and when I came back I did not know how to speak Kannada. So however, now I have learned. So do not do this mistake for yourself. You learn wherever you are, learn the language, because it's an important thing to break the barrier from the patients and build a relationship, and this is one of the game changers when you have a clinical practice. Moving on to the next one, that is tip number 6, or rule number 6, is that set your goal right for internship. The moment you finish your final years and you are in that period of vacation before the internship starts, it's important for you to decide what you need to do. Are you going to pursue your post-graduation, or are you going to open a clinical practice? According to the goals, you have to put efforts in your internship as to what you want to learn. If it is academics that you are trying to be more focused on, that is if you want to pursue your post-graduation, so make sure that you have an entire timetable planned for the year of how you can actually go ahead and finish and complete these 20 subjects. If you are preparing for NEET MDS, how you can going to sort out that, how you're going to take breaks, how you want to repeat the subjects, everything planned, timetable for the entire year, when you will be taking break from your internship, how many days you can take a holiday and to sit down and study. All these things matter, and you plan that out and keep it ready for yourself even before you enter into internship, and you start practicing the goal as soon as your internship starts. I personally started preparing for my entrance examination, post-graduation entrance examination, even before the internship started, 1 month after my final year exams. So if you want to do that, you can do that, or if you want to solely practice, that's build up your clinical practice, make sure you learn all the basic things that are required to run a practice well, starting from extractions to scaling to deep cleaning to normal restorations, composite restorations, basics of root canals, diagnosis. All this you should have mastered, so set that right for yourself. So these are the inputs that I wanted to give for anybody who is doing their internship. Keep this in mind and do it right. I hope this will be fruitful for your 1 year and the way you utilize that 1 year. And if you found this video helpful, please leave a comment. That will help me understand that these kind of videos are bringing some kind of value to your life, and it will also increase the visibility of my YouTube channel on the YouTube platform. So I will be very thankful for that. And go ahead and subscribe to my channel and hit the notification bell icon so that you're notified every time I upload a value-based video. Have a good day and thank you for watching the video. For more such videos, please like, share, follow and subscribe my YouTube channel. You can also follow me on Instagram. Have a good day. Thank you.